Hi folks, this is Dr. Mike, and let me take a few moments to talk to you about our Medical Exercise Program Director Study Group. If you would, make sure you look below this video and you'll see the dates for our upcoming study group. Now, the Medical Exercise Program Director is our highest level certification. This is for the individual that wants to manage a medical exercise training facility or program in any type of setting. Now, I know a lot of you have completed our PRCS or our MES program, or you maybe have some other certification. You're at the point now where you have years of experience working with clients, you have relationships with doctors, therapists, and chiropractors in your community, but now you want to manage a facility or you want to build your own facility. The Medical Exercise Program Director Certification and Study Group is designed specifically for you. So, your role as a Medical Exercise Program Director is to develop, administer, market, promote, as well as educating your staff. Now, these first four, you're going to develop, administer, market, and promote a medical exercise training facility, practice, or program, regardless of the setting, and maybe even your program. And the last component here, your role, is to educate your medical exercise training staff. So the MEPD program is designed to give you all of this, because we know this. The number of medical exercise training facilities and programs will gradually grow over the next 2 decades. And it won't just gradually grow, it'll grow exponentially. Because here's what we also know. The medical community is starting to embrace the idea of working with medical exercise professionals in managing medical conditions with exercise. The general public is starting to realize it, that it's very important, and also insurance carriers are starting to realize it. So if you want to be at the cutting edge and be the one that now really establishes the guidelines, determines what the course is for the next 2 or 3 decades, then you may want to look at this idea of completing our Medical Exercise Program Director workshop. So with the Program Director program, we actually have 4 requirements. One is that you complete our clinical modules. I'll talk about those in just a second. These clinical modules are designed to give you more insight into managing medical conditions with exercise. We also ask you to complete our medical exercise training system modules. Now, one of the biggest things that I've found is we have a tendency in the fitness industry of thinking along the lines of fitness, which is great. But now we have to convert that thinking more to a medically based approach to managing medical conditions with exercise. Well, MET here stands for Medical Exercise Training Systems. Now, as all of you know, I've been a physical therapist now for some 30 years. Recently, I visited my brother in the hospital in Washington, D.C. He had a relatively minor surgery. He's doing very well. But the thing I realized in the hospital is there are a number of medical protocols, hospital-based protocols that go along or are utilized in the hospital system when managing individuals that are coming in for surgeries or other issues. And one of the things I found is here at our facility in Texas, Medical Fitness Pros, we've implemented a series of medical exercise training systems. These training systems now allow you to move your fitness facility to more of a medical exercise-based facility. So you can communicate appropriately with doctors, therapists, chiropractors, but most importantly, produce the outcomes for your clients. And it requires a little bit different approach. So the fitness approach isn't wrong. We just need a broader, more specific approach to manage the medically based client, produce the outcomes, and communicate with medical professionals. This is where our MET modules come in, or Medical Exercise Training Systems modules. I'll tell you about those in just a second. You also, as part of the requirements, must complete a medical exercise training presentation. You can pick the topic. You're going to make this presentation to your peers, other medical exercise professionals, fitness professionals, personal trainers, and also maybe to even medical professionals. Because as I said earlier, one of the jobs of the Medical Exercise Program Director is to educate. So in this program, we're actually going to teach you how to go out and make presentations. And lastly, you're going to put together a fictitious business plan. Okay, as the program director, you may be asked by a club owner, by a hospital administrator to put together a medical exercise training facility. Now you've got to put together the business plan, the marketing plan. You've got to come up with budgets. We're going to talk about that in the program director course with our business plan segments. Now, these clinical modules I told you about, let me mention these again. There are 12 different clinical modules, and we've got a couple that look at advanced guidelines for the knee, shoulder, and spine. There's some cadaver dissection videos here, as well as more specific guidelines on managing medical conditions that affect the knee, shoulder, and spine. We also have a pharmacology for fitness professionals course, our ergonomics for fitness professionals course, as well as essentials of senior fitness, and most importantly, our MedFit assessment segments. These modules specifically look at advanced assessment procedures. Because as the medical exercise program director, your job is to be the liaison between the medical community and the fitness facility. That means you're the one the doctor, therapist, or chiropractor calls to say, hey, what's going on with my patient? Or more importantly, what are you guys doing as far as managing them? But also your role is to understand what that doctor, therapist, or chiropractor has done in their clinical setting, understanding what they've done, and then translating that into information that you can now share with your staff members, as well as help them build safe and effective exercise programs for their clients with medical conditions. So the idea of having a very good understanding and skill set and the ability to assess medical conditions is vitally important. So these clinical modules are self-paced. These modules you'll have access through our MEPD members area, and each one of these comes with a quiz. Some of them may be 4 videos of 4 hours, even some are even 6 hours. And with these video segments, you'll also be able to download the session guides, but at the conclusion of each one, you may have a series of quizzes, maybe 1 or 2 or 3 quizzes you have to complete and then submit those. So this is a self-paced portion of our MEPD program. We mentioned earlier those MedFit assessments. We have MedFit assessments for the shoulder, the lumbar spine, cervical spine, the hip, the knee, the ankle, foot, the elbow, wrist, and hand, and even for gait and balance. Each one of these goes into more depth with regard to looking at special testing procedures, manual muscle testing, even some goniometric measurements are explained in this. And these assessments are probably the most thorough ones you're going to find in the fitness industry, helping you manage specifically the medically based client. That takes us now to the medical exercise training systems modules. Now, this is the real meat of the MEPD program. You now are going to be the program director. You've got to put this program together. You've got to move it from a fitness-based program now to a medical exercise training program. That requires a lot of systems and a lot more systems than we normally see in a fitness environment. So some of the systems you're going to learn about, you're going to learn how to implement, you're going to learn how to actually utilize, include an operations systems, a client management system, an assessment system, a documentation system, as well as a communication system. One of the key things we find now is when we're making that transition of fitness to medically based exercise, we have to document everything we're doing and then communicate effectively with the medical community. We also will talk about a system for marketing and then even a system for medical relationships. This becomes important because not only do you want to get referrals from the doctor, therapist, or chiropractor, but you want to establish a very firm and solid relationship with that medical professional. We also will talk about multiple streams of income. Actually, we'll talk about a system you can implement to have multiple revenue streams coming into your practice, your facility. As we mentioned earlier, we'll talk about how to actually establish and set up a business plan. We'll even go into systems for scheduling and billing. And billing becomes important because we're finding more and more medical exercise professionals are receiving insurance reimbursement. We'll talk about that. There's a whole system that looks at the insurance part. And then lastly, there's a system for staffing and education. As the medical exercise program director, you're responsible for all of these things. And in many instances, working in a fitness setting for so many years, you understand the fitness side. Now you need to learn how to implement these medical exercise systems to really bring about a safe, effective program that produces outcomes for your clients, communicates effectively with medical professionals, and most importantly, generates revenue. So remember, exercise is the key to long-term management of most medical conditions, and guess what? That's going to become more and more prevalent over the next 2 decades. So here's what we recommend. Join our Medical Exercise Program Director program. If you would go to www.medicalexerciseprogramdirector.com to get more information, and the goal of the MEPD program is to bridge that gap between healthcare and fitness. You can see we have a medical professional here with this chart as well as the weight. You're the person that is going to be the catalyst to cause this bridging the gap between healthcare and fitness. Now, if you have experience as a medical exercise specialist, medical exercise program, post-rehab conditioning specialist, or you've been out there working in the field for a long period of time and you feel like now you want to really start to manage a facility to bridge that gap between healthcare and fitness, then go to our website, register. We've got a course upcoming very soon, and it's a 16-week program, so it requires a great commitment, and I would highly recommend it for those of you that have experience, are now moving into management roles, and more importantly, you want to manage your own facility. So thank you for joining us. Best wishes building your medical exercise training practice, and if you would, join us for the MEPD program. I think you'll find it'll be worthwhile. Again, Visit our website, check the dates below for our starting date, and I think you'll find this will be that key you need to really set up a sound and effective practice in any setting. So best wishes, talk to you soon.